Welcome to Money Matters. I am Emily Johnson, Certified Financial Planner and Managing Director of Polaris Capital Advisors. And I am joined today by Casey Bateman, Health Insurance Specialist, and we want to discuss all things where your health insurance matters today. So I know that I see, and this is open enrollment, or we are either approaching or in open enrollment.
We're in Medicare open enrollment right now.
Fantastic. Yes. And I know that I see with my clients that health insurance makes up a significant portion of their ongoing costs. And finding ways that we can maximize the benefits that they receive from those costs is a real focus. And Casey is the one that we go to for that purpose. So Casey, tell us a little bit about open enrollment, Medicare Advantage. Just let's start there.
So Medicare open enrollment is going on right now. It's the perfect time for you to evaluate all of your health care coverage and your needs and any changes that you expect for 2019 from this year. It's the time when you want to evaluate if you have a supplement plan or a Medicare Advantage plan, if any of your specialists have changed, if any hospitals have gone in or out of network from your current plan, to make sure that the coverage needs that you need specifically are there for 2019.
So even if you're happy, if you've been happy with the coverage that you had for 2018, it's worth looking through just those line items of who are my providers, which hospitals may or may I not be looking to. If I needed to go to the hospital, would I be looking at what are my prescription meds, what's in, I forget what they call it, protocol, or there's different, whatever
the formularies.
Formularies.
Yes,
so that plan. Stuff changes going into 2019, and even if you're happy with your 2018 provider, you might want to look at what those changes might be to see if there is a more optimum plan for 2019.
Absolutely, yeah. So especially this year, there's a lot of new Medicare Advantage plans specifically that have come into the different counties in South Carolina here, especially Beaufort County. You have Blue Cross, Humana, United Healthcare, and some other new ones that have come to the area that you can look at to see the pros and cons for each one. The biggest thing you want to look at is their network of doctors. So don't just look at the premium cost, what your monthly cost is going to be. The important thing is to look at the overall benefits that you're going to get from that coverage. Does it have good preventative coverage? Does it have good drug coverage? Does it even have drug coverage? And things like that. So those are the important things to evaluate this year for Medicare Advantage plans specifically.
So that's something that you can help somebody look at, correct? Is the sort of the all-in cost, not just am I paying $123 a month on top of whatever my Medicare costs are, but this is, I take these meds throughout the year, I renew them this many times throughout the year, this would be my copay to go see my primary, this would be my out-of-pocket if X, Y, and Z happen, so that they can get an overall picture of that. Is that
exactly
correct?
And the additional items that are on Medicare Advantage specifically, like dental, vision, transportation, different things like virtual doctor's visits are new things that you can think about. And some new ones even have some fitness benefits like silver sneakers and some other new benefits like emergency response systems that are at no cost if you have different plans.
And that was sort of interesting. We've talked about this obviously off camera before, and it's interesting how many of those benefits that are effectively free or part of the Medicare Advantage plans go unused. I mean, that the one that you just mentioned about the emergency response systems, you see advertisements for those on TV all day, every day, and this is something that's actually provided as part of your plan if you know to ask for it.
Right. And, you know, a lot of people might think I'm too young for this and that kind of thing, and that's fine, but knowing that it's there for you down the line is just a nice peace of mind.
Knowing if you're actually looking at plans for your parents. I know I work with plenty of clients that are looking at these plans for their parents that are in their 80s and 90s. And so knowing that that's there for an older parent that might actually need it and not have that additional cost is fantastic.
Yeah, and speaking of people that are in their 80s and 90s, if you're looking at if they've had a supplement plan throughout the year since they've been 65, and their premium costs have just been just gone up and up and up to just a point where you just can't manage it anymore, considering moving to a Medicare Advantage plan is something you definitely wanted to think about during this time and throughout the year for different reasons. You can get special enrollment periods. But it's definitely something to consider and to talk to your insurance agent about to see if it's really the best fit for either yourself or your loved one, because it can offer some really big benefits and savings if it's the right fit.
And so when you're looking at couples, married couple situations, it's not always a one-size-fits-all, correct? I mean, it
Right.
might be that husband has X, Y, and Z scenario and wife has ABC scenario, so it might make sense for one of them to have Humana and the other one to have Blue Cross Blue Shield. Is that correct?
Yes, and I have a lot of clients that one of them might need to see a lot of specialists at a certain hospital, and so they want to have a supplement plan and a drug plan, whereas their spouse may not have as many issues or specialists that they go to, so a Medicare Advantage plan is a really good option for them. So no, they don't have to have the same plan. But there are some circumstances and some insurances that you do benefit whether the other person has the same plan or not. You can get different discounts based on whether you
File together or have the same
live
plan?
together with somebody over 55. Yeah.
Really? So you could actually even have an older parent and a child. So a child
No, it
over
would
55
be
and-
spouses.
Oh, just spouses.
It would be
Okay.
spouses or significant others living
Okay.
together.
Got
Yeah.
it. Interesting. I didn't know that. Huh. Okay. So if you're looking at, if you know that you might need some sort of elective surgery next year or something that you've been putting off, that's another thing that you should really talk to your agent about as well, right? If a hip replacement or a knee replacement or something along those lines.
Absolutely. You want to know what your upcoming costs are so you know what your out-of-pocket is going to be, whether you have a supplement plan and you want to keep that supplement plan based on that upcoming surgery, or if it would even save you money to move to a Medicare Advantage plan, knowing how much it would save you in the premiums, and you could just put that towards the surgery copay and that kind of thing.
Now, those that are just getting started on Medicare, that this would be year number one. And I know nobody likes to get their AARP card when they turn 50 for some reason, but whenever everybody hits 65, it's like, yes. So for those that are on or looking at Medicare for the first time, what are some of the key points that you would discuss or suggest to them that they should really look at? I know it's probably the same as those who've been on for a long time, but what are some key things that you see that new enrollees might miss?
You definitely want to keep consider your network of doctors. So if you go see certain specialists at different hospitals and you plan to keep going based on your medical needs into the future, you may want to guide that more towards a supplement plan to keep your options more open as far as what doctors and facilities you can go to. But if you're pretty healthy and you're just 65 and you're in good fitness and that kind of thing, starting out with a Medicare Advantage plan can offer some real savings and benefits right off the bat. And if you're not happy with it within the first year of a Medicare Advantage plan, you can get back onto a supplement and drug plan as a guaranteed enrollment period, meaning you don't have to answer those medical questions.
I know one thing that we've discussed before as well is that these Medicare Advantage plans are constantly evolving, and I'm sure that the supplement plans are as well. So if you are grandfathered in to a certain plan, is that something that you look at for that client as well? Is that something, if they're in Part F, G, H, whatever, and that's no longer going to be available, is that something that they should consider as well, of what, if they were to forego the previous plan for a new plan, is there going to be something better?
Sure. So if you have Plan F, for example, Plan F is going to stop being available after 2020. But if you have it, you can keep it. And so that's an important thing. But something else that may be considered also is a Part G plan. So talk to your insurance agent and find out what's the best fit for your medical needs every year. Absolutely.
Okay. All right, fantastic. Well, obviously one thing that I want to point out is that by having a local person, you have somebody that is aware of what's going on in the market, that's aware of the physicians in the market, that's aware of the hospitals in our market, and also the fact that it's not really a transaction. Yes, open enrollment is a period in time, but your health needs are not. That's something that is year-round, and we've all experienced that. So whenever there are questions that you have related to the use of your Medicare, Medicare Advantage, or Medicare supplements, it's great to have a face that you can actually put with these questions or to ask these questions of, as opposed to just the 1-800 number where you listen to fantastic music for a good 23 minutes. So I think that that's a real benefit that I can point out, having worked with Casey on this before, and my clients having worked with her on it before. So something to think about as you are looking at your open enrollment period. So we are going to take a quick break, and we will be right back with more discussion about supplements and open enrollment, and also with private plans for those under 65. Please stick with us. We'll be right back with more Money Matters. Welcome back to Money Matters. I'm Emily Johnson of Polaris Capital Advisors, and I am joined today by Casey Bateman, our health insurance specialist. We've been discussing Medicare, Medicare Advantage, and open enrollment. For this segment of the show, we'd like to move that more into the drug plan section of Medicare and health insurance planning. So take it away.
Absolutely. So this is the time of year that if your medications have changed during the year, that you've been put on a different blood thinner or a different, more expensive medication, you want to go through your medications with your insurance agent to make sure you're on the right coverage, because the formularies can change every year. They can also change throughout the year, but it's important to review those medications every year during this time, because it can matter with thousands of dollars if you're on the wrong plan. So it's really important to evaluate every one of those medications to see where they fall in which tiers, where the deductible is going to fall, and that kind of thing. And this is the only time to do it throughout the year.
So educate me on how are the drug plans different from the Medicare Advantage plans and the supplement plans?
So Medicare Advantage, most of them have drug plans incorporated in it, so it's very similar to the separate drug plans. But if you have a supplement plan, most likely you have a separate drug plan. And that's when you can change it during this open enrollment period, just like you can change into a Medicare Advantage plan.
But this is the only time you can do it?
For a drug plan, yes.
Okay. So are some of the things that come up in looking at that, do they relate to where you should actually purchase your prescriptions from? Because I know that there are a lot of, whether it's, CVS or Walgreens or Burke's, or that there are options for purchasing your prescriptions in lots of different places, and I know there's lots of different perks available. So do you work with some of that stuff, or at least mention that to them?
Absolutely. So if somebody really wants to keep going to a specific pharmacy, that does matter when you're looking at these plans. So if you love CVS or love Kroger or love Burke's, going to them, you don't want to get on certain plans that restrict you to only specific pharmacies.
Like Walgreens is one of those, right?
Like Walgreens is one, but with those specific pharmacies, lots of times you have mail order options that are really good money savers, because a lot of them offer in the top two tiers, which are your more less expensive generics, $0 copays and much lower copays than just going to your 30-day supply at the local store.
So I've looked at a couple of these RX sites, the prescription sites, and there's apps now for this stuff. How do you feel about those? Do you think that those are a good resource for people to look at, or is that more on a national level and it's better to talk with somebody local about the options that are, because it's county-wide, correct? That's where these things are focused?
I think they're really helpful.
County?
Like GoodRx and things like that, and the different discount drug cards are really good to use in addition to, if you already have a drug plan or a under 65 plan that includes medications. It is a good resource to have, because no matter what coverage you have, it still may be not covered, or it still may be less expensive at this pharmacy versus that pharmacy. And those sites can kind of do the work for you and find the least expensive.
It was really interesting. Mm-hmm. So to sort of round up this portion about discussing Medicare Advantage, Medicare supplements, the type of information that you would need to gather prior to making a phone call about your health insurance and looking at those options would be?
Letting me know who your primary care physician is, who your specialists are, what facilities you want to or need to keep going to, whether it's MUSC, Memorial, St. Joseph's, Hilton Head, any one of those, and any drug plans or any drugs that you're on, so we can evaluate those and see that you're on the right plan, or we need to make a few changes during this period.
And if people are looking to travel extensively, because I know I work with a lot of people that travel extensively throughout the year, that's another factor, correct?
Absolutely. So you want to keep in mind whether you have a PPO plan or an HMO plan or a supplement. If you have a supplement, pretty much you can go anywhere with the supplement in the U.S. And with a Medicare Advantage plan, sometimes those are based on your county and your state. So those are things to communicate to your advisor as far as what would be best for your needs.
Okay, awesome. So now let's take it into the under 65 scenario. So under 65 is a different open enrollment, correct?
Right, so it starts November 1st and it goes into December 15th to have a January 1 effective date.
So if you're under 65 and do not have an employer-based plan, then this is what we're talking about. It's a private market plan, Obamacare, whatever other phrases you've heard.
The marketplace, healthcare.gov.
Yes, so we're talking, that's one and the same is what we're talking about here. So health insurance for those under 65. So how has that changed this year, and what might people be looking at as they go into
So
this
2019 is going to be interesting because there's no tax penalty as of now for 2019, which means if you don't have health insurance, you will not have that tax penalty at the end of the year. So that is going to be interesting to see how many people decide to drop their coverage and go self-pay. And another change that has occurred is also short-term plans can now be extended instead of being 3 months and then renewed 3 months later, where your deductible resets during that time. You can now keep them for 12 months. So that's something to go over with your insurance agent.
Explain that a little bit, because I know we've in fact, there's two scenarios I'd like to talk about in the time that we have. One is if you have a private plan, let's say you're a family of 4, this is a scenario that we've discussed before. You're a family of 4 and that premium has escalated significantly and you have a healthy family. Or maybe it's just you and your spouse, maybe it's just you. But you're a healthy individual, you don't necessarily need all the bells and whistles on the more aggressive, more expensive plans. What are some scenarios that
So that is a perfect example of somebody who may be a really good candidate for a short-term plan. Granted, a short-term
is now a year.
But a short-term plan does have pre-existing conditions. There are clauses that would be a non-covered thing. So if you're a healthy family and don't have any pre-existing conditions, then that's something that you would definitely consider to save a lot of money for your family throughout the year.
And what that basically means is you'd probably have a much higher deductible, but your premium is going to be significantly less out of pocket. So from a planning perspective, when I look at that, I want to make sure that the deductible is something that is either 1, very, very unlikely, and also 2, not going to break the bank. So if it does make sense that you have a family deductible of $6,000 or maybe even more than that, I've certainly seen higher than that, and you do have the ability to pay that not on credit cards, then I do think that it makes sense to look at plans like that. If, however, you're in a situation where a $6,000 hospital visit, if it's capped out at $6,000, is going to literally send you to bankruptcy or cause you so much stress that you can't sleep at night, then that probably is not going to be the best option. Some balance between those two really makes sense. And there are balances. In fact, you can have 2 together.
And
right?
there are different kind of add-on plans that you can do that would be specifically hospital-based or different plans throughout the year that would give you different payouts for different services. For example, some might give you $1,000 per day for an inpatient stay. Some might give you $100 for a doctor's visit, $100 towards a wellness visit, that kind of thing. And there are other accident riders and things that if you do have a $10,000 deductible plan that would break the bank, if you can add those accident riders on, they're a little bit more per month, but it would give you that payout should you need it if there is, you break your arm in a bad accident or something like that.
Right.
Yes.
And then the other thing, same with Medicare, is that if it might not be that each member of the family needs the same insurance. I know that there's discounts for having a family, but there's never a discount for really having a family. It's just expensive no matter what. But it's in terms of mom and dad might be on a different plan, kids might be on a different plan, depending on what makes the most sense for them, and also financially what makes the most sense.
Absolutely. So. You can split it up, but you definitely want to think long term as far as the entire year goes for the whole family. So if mom may be considering having another child and that kind of thing, you definitely want to make sure that she has that all-inclusive coverage that you may not get with other short-term plans.
So same scenario. Once again, we'd want to gather names of physicians, preferred institutions, prescription medications, any sort of anticipated upcoming events, and gather that information and make a phone call.
Absolutely.
Okay, and I want to stress one more time that the real importance, in my opinion, of having a local agent is, number one, that they know the marketplace, they know which providers accepts different plans in general and can certainly have access to that information much more easily. But most importantly, is that this is not a transaction that ends right there. If you have additional questions throughout the year regarding the use of your insurance, that's really what they're there for. So please consider that when you're looking at the advertisements that you see during open enrollment period, and please definitely give Casey a call. So thank you so much for your time, and we look forward to seeing you next week with more Money Matters. Have a great week.